Hello, everybody. Welcome.
Hello.
We're
Hi,
just going to
everybody.
wait 22 seconds here to see if anybody else rolls in here a little bit late, and then we're going to get started. So, all right, that was a fast 22 seconds, but I think we're ready. All right, so this is New Jersey Medicare 101. It's the basic of your Medicare options. New Jersey Medicare 101 is a nonprofit organization that is a part of a larger organization called USA Medicare 101. And it's for people who are in your positions right now who are looking for information about Medicare, whether you are going to be turning 65 next month, in a year from now, or you're already on Medicare. This is a great workshop for you to learn about the options that you already have. And New Jersey Medicare 101 works through local agents and agencies like us. So we're going to introduce ourselves here.
Okay, my name is Jamie Sholem. I am the founder and president of Senior Star Insurance Group. I have 20 plus years actually in professional service to the retired community, 65 plus community. For most of that time, it's been in retirement planning, life insurance, and in Medicare planning, which I've gravitated to and I became a specialist in. I've worked for national companies. I've enrolled thousands of people into their own individual Medicare plans. I was responsible for recruiting and training agents so that they could help their clients. 6 years ago, I went out and I opened up Senior Star Insurance Group. We're based in Old Bridge, New Jersey. I did that for a couple of reasons. Some of the companies I was working for had one focus in Medicare, and they weren't allowing their clients to have the full options, and I didn't want to do that. So I'm very, very glad we did. We've done these workshops and webinars. We do them every month. I'm glad to be in front of you tonight to talk to you about Medicare. Welcome. A year and a half ago, my son Ethan, who you just saw, came on board. He joined the firm, and I'm going to let Ethan introduce himself and go from there. So, welcome.
Hey, guys. Hello again, I guess. I'm Jamie's son. I've been working with Senior Star for about a year and a half now. I'm licensed in multiple states and I'm contracted with all the major carriers in those states. Uh, these workshops have given me most of the knowledge that I have on Medicare. I'd say about 75, 80%. This is how I learned Medicare. So you guys are going to walk away from today with a lot more information than you came in with. And you're going to have a better idea of any next steps that you have to take, no matter at what process of this or what step of this process you are at. So let's move on.
Okay, so we're going to talk about facts tonight. We know that if you're, of Medicare age and you're turning 65, that you're getting swamped with mailings and in your inbox and your mailbox and every other way. Some of it is designed to look like it's official or from the government, and it's not. Some of it may be legitimate, but you don't know what it's talking about. We're going to clear the haze on that, but we're not going to do it in a biased way. We're not making any recommendations. We're not referring a company to you. We're just going to get to the facts of Medicare to arm you with the information that you're going to use when you make decisions for yourself. Let's get into some terms that we're going to use tonight. You may know some or all of them, but we're going to do it anyway just to make sure. First term I want to go over is a premium. That's the monthly rate that you're going to pay to be in whatever plan you're going to be in. The deductible is the amount that you will pay first before that plan comes in and covers you in any way, shape, or form. A co-payment is a set payment for your visit to the doctor or that treatment that you have. It's a dollar amount. It's set. You're going to know what it is before you go. Co-insurance is also your co-share for that visit or treatment, but it's a percentage. So instead of a $40 visit to the doctor, it may be 30% of the total visit. We don't always know what that's going to be. Is that going to be higher than a copay or lower than a copay? We don't know. We're unsure on that. And then finally, a very important term. It's called a maximum out of pocket. Now, sometimes people confuse that with a deductible. It's not. It's sort of the opposite in the sense that it protects you. If you have any year where you have a lot of out of pocket expenses due to the medical care that you're getting, well, there's a threshold that once you meet that number, they're going to protect you at 100% for the rest of the year. So it's really a safety net for you. All of these terms have interchangeable levels of importance depending on the kind of Medicare plan we're talking about. But we just wanted to get this as a baseline so that when we use the terms later, you'll know what they are. Okay, so what are we going to actually talk about today? We're going to talk about the different parts of Medicare, that A, B, C, D, the alphabet soup. We're going to define what those parts actually are. We're going to talk about what the costs are in Medicare. It's not free. There are deductibles, there are premiums. We're going to get into that. How and when to enroll. What's your timing? Do you have to enroll? Well, we're going to let you know about that. Um, what happens if you don't enroll on time? What is the government going to do? Well, there are late enrollment penalties. They're kind of scary, but not everybody really knows exactly what that means. You will know what that exactly means before you leave here tonight. What is a Medigap plan? What is it also called a Medicare supplement plan? What is an Advantage plan? What's the difference between the two? We're going to cover that at in depth tonight. And we are going to tell you why it's meaningful and why it could benefit you to use an independent agent. We are going to give a couple of minutes because we don't know that everybody is not aware of how this works. We want to tell you a couple of quick things about that, how we get paid, how it will affect you. So we're going to spend a minute or two. And then finally, we're going to talk about next steps. By virtue of the fact that you're in this webinar right now and you're getting informed, you're ahead of the game. How can you continue to do that and to educate yourself? If you're not ready to go into Medicare right now, what can you do to keep yourself abreast of all the information that you need to make better choices for yourself? So that's our agenda for this evening, and we hope you get a lot out of it.
And we're about to get started once I move to this next slide, but I do just want to say there is a chat section here. We encourage you guys to ask questions. The chat is public, so everyone's going to see it. There's also a Q&A section, which comes directly to us if you wanted to keep it more private, and we'll answer them out loud either way. But if you didn't want to see anybody to see your question, you can ask that. And we encourage you to ask questions. We're going to address those questions when we find it appropriate, and we're going to have a Q&A at the end. So let's get the ball rolling. First, we're going to discuss the different parts of Medicare. There's A, B, D, and C. Part A is known as hospital insurance, and this takes care of all of the insurance that you need inpatient. So if you're admitted into the hospital, or if you need skilled nursing care or hospice care, Part A takes control of that. Part B of Medicare is known as medical, and that is anything that you need outpatient. So doctor visit, lab work, tests, treatments, and outpatient surgery where you're in and out the same day. That's where Part B is going to come into play. Both Part A and B together are known as Original Medicare, and this is the foundation for everything that you will do in Medicare. So before you get any of these other things that you see, you need A and B together. The problem is A and B leaves you exposed to higher copays, deductibles, and costs. Part B only covers 80% of anything you do outpatient, meaning that you owe 20%, and there's no ceiling of protection. There's no cap on that. And Part A has a different deductible structure, but you're exposed there as well. So it also doesn't cover drug coverage. That's where Part D comes into play. You can remember that pretty easily. Part D, drugs. You can get Part D drug coverage in two different ways, which we will discuss today. And then we have Part C of Medicare, which is out of order on purpose because it's actually not really a part of Medicare. It takes over for Medicare, and it kind of combines Part A, B, and D into the Advantage plan. So Part C and an Advantage plan are the same thing. They're interchangeable terms, and we're going to dive into all of this here today. So we're going to talk right now about the costs of Part A if you didn't have any secondary insurance. So these costs may be higher than you like. There's solutions to that. But right now, I'm just going to give you a baseline. If you just had Part A hospital insurance, with nothing supplementing or adding to that coverage. Most Americans are going to pay $0 for Part A of Medicare. As long as you or your spouse has worked 40 or more quarters paying taxes here in America, then you're not going to pay for Part A of Medicare. Now, if you are admitted into the hospital, will you have charges? Yes. You're going to have a deductible of $1,676, whether you're in the hospital for one night all the way up to 60 nights. So if you're there for 60 nights, 1676 is not too bad. If you're there for one night, it's a little bit of an inconvenience there, but it's still not terrible. Now, if you're there for 60 days or more, that's when you really start to see some high deductibles. You will have a $419 daily deductible if you're there from night 61 all the way up to night 90. And if you're there for 90 days or more, then it goes to a daily deductible of $838. So that's $838 per night that you're there that comes out of your pocket. And it chips away at this lifetime reserve day. You only get 60 lifetime reserve days in Medicare for your hospital insurance. And once you're there for 90 days or more, it chips away at that. Now, you may be saying to yourself, who's in the hospital for 60 or 90 days? But the structure of the benefit periods in Medicare are not really as straightforward as they may seem. Because if you're not out of the hospital for 60 full days, then that benefit period is still active. So let's say you're in the hospital for 10 days, you're out for 30 days, and then you go back in, you're actually still now on day 40, and you're getting closer to that 60th day. So that's how you can really reach those daily deductibles. If you were to be admitted to a skilled nursing facility, Medicare covers you for the first 20 days in full. But there's no magic dust out there that says that you're just going to need to be there for less than 3 weeks. So from days 21 to 100, you're going to have a $209.50 daily deductible. And then from day 100 on, that's all up to you. There's limited home healthcare services, and there's hospice care as well in Part A. So Part B of Medicare. Well, Part B is not free. You're going to pay a monthly premium. In 2025, the average American is paying $185 just for Part B. Now, if you're a low-income earner and you're on Medicaid, then that will be $0. If you're a high-income earner, then you're going to be subject to a surcharge known as IRMA. IRMA stands for Income Related Monthly Adjustment Amount, and your premium can be higher than $185. I'm going to show you later on towards the end of this presentation what those monthly premiums can be. So you pay your monthly premium and you go to the doctor or hospital. What are your charges? Well, you have a $257 yearly deductible, which is not too bad. If you're on a work plan now, your deductible is probably a lot higher than that. But once you're past that deductible, you're going to owe 20% of everything that you do, and there's no ceiling of protection. So that means if you needed chemotherapy, you're going to be paying 20% of every single treatment. Or if you needed a surgery outpatient, then you're going to have to pay 20% of whatever that charge is. If that charge is $1 million, you're going to be paying 20% of that. So just as Part A leaves you exposed, Part B definitely does as well.
Okay, so now that we've scared you, or not us, but Medicare has scared you, what do people do about those potential costs in original Medicare? Well, there's two main paths that people take. And I've coined the term, the one on the left, I've coined the term government path. It's not an official term. But the reason I call it the government path is because you're allowing your original Medicare card to do the heavy lifting. You're allowing your Part A and Part B and Medicare to be your primary insurer. And so what you're going to do, because of all of the gaps that Ethan just mentioned to you, and the fact that it doesn't cover drugs, what you're going to do is you're going to add a standalone drug plan, which you're going to choose based on your prescriptions. We can help you filter through your prescriptions. You'll choose a standalone drug plan that makes the most sense for you at the pharmacy you like to go to. And you will add what's called a Medigap or Medicare supplement plan. It's the same thing, interchangeable terms, to cover those inpatient hospital deductibles that Ethan mentioned, as well as the 20% that you would have to deal with on an outpatient basis. So this is the government path. There's three separate cards. There are going to be three separate monthly premiums. It sounds expensive. It sounds confusing. Why would anybody do that? Well, there's two main reasons. Number one is if you have original Medicare as your primary insurance, you can go to any Medicare provider in the entire United States of America, not just around the corner, anywhere. And so you're not in a network anymore. You've never had more freedom to choose your providers in your life. So the freedom is one thing. The other reason is you have stability in knowing what your costs are going to be. Medicare covers 80%. The Medigap plan covers 20%. And that's true if you go to the doctor twice a year for a well checkup or if you have 4 surgeries and 2 hospitalizations. You will not be paying more if you get sick. You will be covered. So, for the stability of knowing what your costs are going to be, whether you need to pay it or not, you're knowing what your costs are going to be. And the freedom, it's a very attractive pathway for a lot of people that are going into Medicare. Now we're going to shift gears. On the other hand, the other way to be in Medicare is to do what's called an Advantage plan. It's also known as Medicare Part C. You'll see that Medicare is confusing enough as it is. It gets even more confusing when everything has two names, and which almost everything does. So, a Medicare Advantage plan, also called Part C of Medicare, it will take over for original Medicare. You are not in original Medicare anymore, which means a couple of things. You cannot go to any original Medicare provider in the country anymore. You're in the hands of a private health insurance company. You have one card that's issued to you. Your Part D drug coverage is included in most of these plans. You would make sure that it is. No separate drug card, no separate monthly premium for the drugs. It's included in the plan. It also has what Medicare considers to be extra benefits, things like the dental, vision. It's got hearing aid coverage. It will give you over the counter items in many of these plans where you can go and you can get, vitamins and, health related products, band-aids, toothpaste. It will actually give you something that looks like a gift card and it will pay for some of those items. They're attractive. They have a lot of benefits. But be aware of the fact that you're going to be in a network in these plans. Some of them are big networks. Some of them you can even go out of the network. But if you go out of networks in those plans, which are called PPOs, well, you may need pre authorizations for certain things and you will pay more. So the idea is that you're going to want to stay in network anyway. And so that's in summary, that's kind of the differences between the two pathways. The biggest attractive thing about the Medicare Advantage plans is that most of them, or many of them, will have no monthly premiums to be in the plan. Your fixed cost is going to be whatever your Medicare Part B premium is. For most of you, it's going to be $185. But you will not have to pay an additional premium to be in a Part C Medicare Advantage plan.
All right. So we're going to talk a lot more about both of those individually, and we're going to compare them again later on. Right now, we're going to talk about when you can actually get into Medicare. So if you're collecting Social Security, they're actually going to send you your Medicare card about 3 months or so prior to the month of your 65th birthday. But if you're not collecting Social Security, then you have to knock on their door and you got to let them know that you want to get in. This is known as the initial enrollment period, and it's a 7-month window. It's 3 months before your 65th birth month, or I guess your birth month's the same every year. So it's 3 months before, the month of, and 3 months after. And this is an important time because you want to make sure you're avoiding any late enrollment penalties. You want to make sure that you're choosing a plan that suits your needs. and it's a vital transition point. So you really have to, take note of planning for Medicare during this time. This is the big question that a lot of people have. What about if you're on insurance through your work plan or your spouse's work plan or some other form of insurance like Obamacare? Do you have to go on Medicare? And the answer is sometimes. Sometimes you do. So you're going to need to make sure that your plan is deemed creditable. It's creditable. What does creditable mean? Well, the work plan has to have 20 or more people on the plan. So if you're at a small law firm and you have the greatest plan in the world, but there's less than 20 people on it, it's not going to be deemed creditable. And then the second requirement is that it has to have the stamp of approval that the insurance is actually good by Medicare. It has to meet a standard requirement, and then Medicare deems it creditable. So if your plan is creditable, then you're going to be eligible for a special enrollment period after you turn 65. So you don't need to go on Medicare when you turn 65 if you have a work plan that's deemed creditable. This special enrollment period for Part B allows you to get on 8 months after you lose that creditable insurance. So you'll be able to have an 8-month window after you lose that insurance to get on Part B. But for Part D, you only have 63 days to get on to avoid a late enrollment penalty. So basically, you have 2 months. But either way, I mean, you're not going to want to wait 2 months or 8 months to get on Medicare and be without insurance for that time period or pay extremely high rates if you have Cobra. So, we'll time it so that when you know that you're going to retire or if you lose your work insurance, you're going to get on Medicare then first of the next month. Let's say you messed up and something happened where you didn't get on Medicare in time. You will see late enrollment penalties. And we're going to talk about what they are right now. So there's late enrollment penalties for both Part B and Part D of Medicare. The penalty is based on the standard monthly premium. So if you've not been on Medicare for a 12-month window, so for a year, then you're going to get a 10% penalty. If you're not on Medicare for 2 years, then you're going to get a 20% penalty. So let's say you haven't been on for 2 years, you're going to pay an extra $37 per month in addition to the standard monthly premium. For Part D, the structure is a little bit different. It's a 1% penalty for every month that you haven't been on Medicare. So let's say you didn't get on Part D for 2 years. That's a 24% penalty based on a standard monthly premium that Medicare comes up with, which is $36.78. Your Part D drug plan may not cost $36, but that's the standard rate that Medicare will base this late enrollment penalty on. So that means that if you have a 24% penalty, you're going to be paying $8.83 in addition to whatever you do have to pay for your drug plan. Now, there's two things that I want to note here with these late enrollment penalties. The first is that these charges never go away. So if you get a late enrollment penalty, you're going to have these charges for every single month for as long as you're on Medicare. And for most of us, that's the rest of our lives. The second thing I want to note is that the standard monthly premiums for both Part B and D go up every year. So the percentage that you're paying, that fixed number is not fixed. It's going to be going up as well. Cobra is not deemed creditable. So if you retire and you're on Cobra, you're going to want to get on Medicare within that 2-month window. Get Covered New Jersey, Obamacare, ACA, whatever you know that as, is not creditable either. And some employer plans are not deemed creditable. So if you are on an employer plan, you're going to want to talk to your HR department and you're going to ask if the plan is creditable. You can talk to your benefits administrator and you can simply ask, is the plan creditable? They may actually provide you with a letter of creditability that can just give you peace of mind to know that you're going to be avoiding any late enrollment penalties. and we're going to go into the annual enrollment period here. I see there's a question in the chat that I want to address. I am covered under spouse insurance. Can I delay and use SEP? Michael, if the plan is creditable, you can. Like I just said, ask your HR department or ask her HR department. Now, Medicare may be a little bit better in coverage. I'm not sure. I'd say it's about 50-50. But if the plan's creditable, then you don't have to worry. I see there's another question. How Medicare works, original or PPO, when you travel out of the country? That's a good question. I think we should probably address that later, though, right, Dad?
Yeah.
About Medicare out of the country? Okay.
Yeah.
We'll get to that, Roberta, for sure. Good question. So you get on Medicare. Is that permanent? Is your first decision permanent? The answer is no. There's an annual enrollment period every single year. If you turn the TV on, you'll see those advertisements between the months of October and December. The annual enrollment period lasts from October 15th to December 7th, and you can make many changes during this time. Let's say you are on a Medicare Advantage plan. You can switch that plan to another Medicare Advantage plan with the same company or a different company. You can drop the Medicare Advantage plan and pick up original Medicare with a standalone drug plan and a supplement plan as well. Now, let's say you're on a drug plan, you can switch the drug plans. So if there's a better drug plan out there for you with a lower premium or maybe a higher premium but lower copays at the pharmacy, this is the time frame in which you can make that change. And you can also switch your Medicare supplement plan at this time of year. You're actually able to switch your Medicare supplement plan at any time of year, but you can also do it during this time of year. There's something that I want everybody here to take note of, though. When you are first electing to get into Medicare, whether that's through your initial enrollment period or your special enrollment period, nobody is allowed to ask you any health questions. There's no medical underwriting process at all. But after your first election in Medicare, if you want to go into a supplement plan, or if you want to switch your current supplement plan to another to either save money or just get into a plan with different coverage, they will ask you health questions. They have the right to, and they definitely will. And they also have the right, based on how your health is, to either increase your premium or outright deny you. So when you're first getting into Medicare, you definitely really want to pay attention to, that fact. Do you want to answer health questions later on? If you're fine with that, then an Advantage plan is good for you. But if you're a little bit worried about your health and you want to go to a supplement plan, you're going to want to do that when you're first electing to go to Medicare. All right, next slide. So now we're going to talk in these next few slides about these Medicare supplement plans. We're going to get into some real detail about them. So just like the parts of Medicare, the Medigap plans are also identified by letters, just to make it a little bit more confusing for you. And it gives us a little bit more of a purpose, I guess, because it makes it more confusing for you. So some of these letters are the same letters as the parts of Medicare as well. But we're lucky in that the popular Medicare supplement plans are identified by different letters. They're Plan G and Plan N. Those are really the only two supplement plans that we would be talking about or that you would be interested in. So one thing I want to note is that all of these plans, so if you have a Plan G with company X or company Y, a Plan G is the same. They're federally standardized. So there's 24 companies in New Jersey that offer these federally standardized Medigap plans. A Plan G with one company is the same exact Plan G as another company. Same as Plan N. Plan N with one company is the same exact Plan N with another company. It's not a matter of what one company covers versus another. It's the same exact coverage. But there's a few things that do differ from company to company. The rates are one of them, and the logo on the card is the other. So how do you know exactly which one to get into? Well, you want to know their financial rating. When I was in college, I would take a B+ any day of the week. But when you're getting into a Medicare supplement plan, you're going to want something that's an A or more. You also want to know how aggressive they're raising their rates for their current beneficiaries. We can never predict what's going to happen in the future, but it can give us a good idea of how they treat their current beneficiaries. So you're going to want to avoid a company that's raising them aggressively every single year. A little bit more about these plans here. A supplement plan works with original Medicare. So original Medicare stays as your primary. It goes on top of it. So Medicare leads the way, and the supplement plan is there to fill in those gaps. That's why they call it a Medigap plan. These Medigap plans, they're offered by private insurance companies. You've heard of them, and some of them you haven't heard of. And these private insurance companies are going to charge a monthly premium for you to be in this plan. There's no networks. As long as the provider takes Medicare, and 97% of the providers in the country take Medicare, then no matter the secondary company, they will take you. I've mentioned this a few times, but I want to mention it again. All of these plans are standardized. So there's no difference between a Plan G with the biggest brand name company in the world versus a Plan G with Frank's Red Hot Sauce Medicare plan. So it's the same insurance. And I want to say that because when you're getting into Medicare without having to answer health questions, there's no reason for you to be paying more for a monthly premium when you're getting into a Medigap plan. These plans, they remain the same. So it's going to remain the same from year to year, which means no surprises. You're going to know what you're going to be paying for your healthcare on a yearly basis. And there's no pre-authorizations or referrals. So you're going to have more freedom than you've ever had, probably in your health insurance coverage here. All right, so we're going to get into a little bit more detail of what Plan G and N actually covers. I know this chart here looks like a lot, but you're going to have an opportunity at the end of this webinar to get this chart along with a summary of our workshop here, of our webinar. You're going to get a booklet called Everything You Need to Know About Medicare. If you just fill out a survey, it takes about a minute or two. So I suggest you do it, and it just lets us know how we did today. So we would appreciate that, and we're going to give you something for it. So Plan G of Medicare is the most popular Medigap plan. And one of the reasons for this is because upon being admitted to the hospital, this plan is going to pay all your deductibles, your copays, and your coinsurance. It's very likely to be the best inpatient hospital coverage that any of you have ever had. Plan G also covers all copays and coinsurances outpatient once you get past that $257 yearly deductible. That's the only thing that Plan G doesn't cover, that $257 Part B yearly deductible. So once you pay that $257 at your first or second doctor's visit, then you're not going to be paying anything for lab work. You're not going to be paying anything for a normal doctor visit, a checkup, an infusion, a cataract surgery, organ transplant. You're not going to be paying for anything in a Plan G. Plan N is very similar to Plan G. It's a lower monthly premium because there's a few differences on the outpatient side of things. Hospital insurance is exactly the same. You go to the hospital, no deductibles, no coinsurance, no copays. But outpatient, there's three differences. You'll have up to a $20 copay at only doctor's visits. So that's not lab work or an MRI or anything like that. Only a visit or a checkup at your primary care doctor or your specialist will you have up to a $20 copay. You'll have a $50 copay in the emergency room, and it doesn't cover a very rare fee known as an excess charge. I'm not going to get into what that is right now, but it's super rare. None of our clients have ever come to us and complained about it, but it's there, so we want you to know about it. There's a little bit more exposure in Plan N, so when people are getting into Medicare, they say they like Plan G. Plan G is a little bit more popular, but we feel comfortable putting people in either Plan G or N. We like them both a lot.
Can I interject something before you move on to the next slide? Somebody
Sure.
was asking about foreign coverage outside of the United States. And I want to add to it now that we're in this outline of coverage here. Original Medicare does not provide coverage outside of the US except for limited coverage near the borders. So if you're going overseas, even the Caribbean or anywhere else, you have just original Medicare, you're not getting any help. However, when you have a Plan G added onto it, this plan actually provides you with something that Medicare doesn't, in the form of a foreign travel coverage. So Plan N, the same thing. So if you it's emergency coverage. If you're going to go overseas and you're going to live somewhere and you need regular medical assistance, this isn't going to do the job. But if you're visiting and you get injured for emergencies, Plan G will help you with that coverage. It's not 100%, and for the purposes of time, I'm not going to get into it, but it's pretty robust emergency coverage for overseas. So I wanted to address that, and we'll talk about how that's handled in a Medicare Advantage plan when we get to that subject matter. Thank you, Ethan.
And now's the time at Medicare Advantage.
Right on time, right on spot. Okay, so we're going to shift gears and we're going to talk about the other way to be in to be in Medicare as an individual, and that's a Medicare Advantage plan, the private pathway where you have a private insurance company taking over for original Medicare. This year in the state of New Jersey, there are 10 different companies that offer 41 different plans. There are multiple networks, multiple copay, features, multiple doctor networks. They all have copays for services that you do. And so you want to be aware of that. And they'll have different benefit levels and different extras. Now, to dive down a little deeper into these plans, and I do want to say you can't be on both at the same time. You have to choose one pathway or the other. You can't be on a Medicare supplement plan and an Advantage plan together. So here we are with an Advantage plan Part C. Well, it's the benefits of Medicare rolled into one, put into a managed care plan, similar to probably what you have now through work or otherwise, in that you have to follow a network with set copays. It require that you get Medicare Parts A and B and pay your Part B premium, whatever that turns out to be. It takes over for original Medicare. So you're in that private company now. You will have networks, as mentioned. It will include drug coverage. So your Part D of Medicare is handled within a Part C plan. But it also gives you a lot of value because it gives you these extra benefits like dental, over the counter items, hearing, and other things. Some of these plans actually give you money back towards your Part B premium. And so and not to say that you would choose that plan automatically. You would always have to kind of do a cost benefit analysis on the other features of the plan. But there are a lot of different plans. And most importantly, many of these plans you'll be able to get into for a $0 premium. So it's not going to give you any additional fixed costs in having what I consider to be excellent coverage. So, what do these costs actually look like for these co-payments? Well, there are three columns here. I'm not going to talk too much about the lowest. Those co-payments are if you have a special needs and a special kind of Advantage plan. And the highest is if you do go into a plan, a PPO, where you can go out of network, and you do for everything. So I'm going to stick to what's likely, what most of our clients are paying around in some of these various plans. Well, it's very likely you're going to get into a plan, first of all, with no monthly premium. Your maximum out of pocket, that's that level of protection that you have, where if you've reached that number of out of pocket costs, they're going to cap you, and now you don't have to pay anything anymore for the year. Well, it's around $8,000 if you stay in network. Some plans can go up to $9,250 this year. Some of them are lower. They're in the $7,000 range or even lower than that in some cases, but figure that your protection level is going to be around $8,000 as a general rule of thumb for these Advantage plans in 2025 in New Jersey. Now, hospital stays. The way that these plans approach charging you for a hospital stay is they're going to give you a daily rate, a daily deductible up to a certain number of days. So we're giving you an average 10-day look. Not to say that this is going to be what everybody pays the second that they go into the hospital, but we wanted to spread this out a little bit and give you an idea of what a longer hospital stay might look like. So some plans, there's one popular company that has a $390 per day up to 5 days. There's another that has $320 up to 7 days. So, the idea is that if you're in the hospital for 10 days or more, you might be paying around $1,950, somewhere around that $2,000 threshold. Of course, some will be higher than that, some will be lower. Now, anything that you do spend in terms of a hospital copay will go towards your maximum out of pocket. All right, so just so you know. Now, what are the other charges? Doctor visits can vary from your primary care visit being zero. A specialist will cost more than zero, but it might be 15 bucks, it might be 35, and it may be a percentage. In some cases, if you go to a specialist, it's not a set copay, it might be co-insurance. And the same thing if you go out of network, it might be co-insurance rather than a copay in the plans that allow you to go out of network. And finally, there are a whole bunch of other things, labs, diagnostic tests, x-rays, that can vary tremendously from plan to plan. But to give you an idea, some of that stuff isn't crazy. It's not that expensive. If you have therapeutic radiology or if you need an MRI, some of those things may come into play and charge you more. If you have an outpatient surgery, well, you'll have a fee for that. It might be $375 for your cataract surgery, and so on. But you'll know what it is before doing it, and it's not going to be $4,200 for your cataract surgery. So, and that varies tremendously also from company to company and plan to plan.
We got a question. I think it's a good time for
Yeah.
it. Does the out of pocket include drug costs? The maximum out of pocket, does
That's
it
a great
include the drug
question, and
costs?
we do get that a lot. And the answer is no, but there isn't. The cost of drugs in Medicare is handled separately from from the medical costs. In both in a standalone drug plan and when it's through a Medicare Advantage plan like this. However, the Medicare drug costs have been capped themselves in Medicare this year, completely separate from this maximum out of pocket. And the way that that's working in Medicare now is if you have a plan where your drug is covered in any way, shape, or form, the maximum amount you'll be able to spend or you'll be required to spend for copays for drugs in 2025 is $2,000. That doesn't include a drug plan premium. And as I said, in Advantage plans, most of your drug plan premiums are zero. So if you're on a really expensive drug, as long as it's on the formulary, the list of drugs covered by that Medicare Advantage plan, the most that you will pay for that drug is capped at $2,000 for the entire year. Now that's new to Medicare, and but it's also a cause of concern in some ways in that you remember when Ethan said that in order for your work plan to be creditable, it has to have at least the same minimums as Medicare. Well, some employer plans don't have $2,000 caps on their drugs. So creditability in those employer plans, even if they have over 20 people in them, are something that you need to look at and something that you need to, verify with your employer. Employers they're not required to give you a creditable drug plan. They are required to tell you if their plan is creditable. So I'm sorry to mix that in. But yeah, so your drug costs are capped separate than this maximum out of pocket. But that's a great question. Now, all right, so it sounds a little confusing. Like, how do you connect the dots if you're looking to be in one of these Advantage plans? Like, a lot of it sounds like it's right up your alley, especially no monthly premium, the extra benefits. A lot of that stuff sounds great, right? Well, how do you choose these plans? And obviously, this is something we help people and we walk them through. Well, we want to lead with what you need. We don't want to go for the bells and whistles first. We don't want to look at what most of the advertising you're getting is geared towards. We don't care how many free rides you get to the doctor or how many, food stipends they give you. What we want to know is the first thing is prescriptions. Are your prescriptions covered? Because if they are, you're going to be protected by that $2,000 cap, first of all. But if they're not, well, you have to pay out of pocket. What's that going to cost you? So we're going to take a look at that first. Then we're going to look at your doctors. Even if you pick a plan where you can go out of network, you really don't want to. So we're going to look at your doctors, what facilities that they're associated with, what hospitals. If you have to follow a treatment plan and you need to go for the outpatient surgery or you need to be hospitalized for surgery, well, we want to make sure that those facilities with your doctor are in network. Uh, and then we're going to compare. Then we're going to look at the co-pays for doctor visits and some of the other items, outpatient surgeries. And the last thing we're going to do is look at the extras. The last thing we're going to do is look at the bells and the whistles. Now, I know dental plans are very, very important. It's not exactly an extra, but it kind of is when you're looking at this. You want to make sure that the high ticket items and that your medical coverage is covered well. Now you can do this on your own. There are tools you can use as a consumer. You can go to an agent. You can go directly to these companies. I don't recommend it. Or you can use an agent to help you, filter your way through what your possible plans are. And that's how we deal with these Medicare Advantage plans.
All right. So people will, tell me at this point, I understand the difference between the two plans, or I kind of don't really understand the difference between the two, but excuse me, but how much does it actually cost? So that's what we're going to take a look at right here. So the blue is the Medicare supplement for both a male and a female, and then the green is the Medicare Advantage. What you're going to notice across the board is that the first two line items are the same. Part A will be $0 as long as you or your spouse has worked 40 quarters or more and paying taxes. Part B will be $185 for the average American, unless you have Medicaid or an IRMA surcharge, which I will discuss in the next slide. So your baseline is going to be $185, whether you go Medicare Supplement or Medicare Advantage. Now, for a Medicare Supplement Plan G, we're going to use that here as an example, not an overall recommendation, just as an example because it is the most popular. For a female, it could be $148. That's not the least expensive plan. It's definitely not the most expensive plan for a female that's 65, but it's on the lower end, and that's a very fair rate that you may be paying in a Medicare Supplement Plan G with a company that you feel comfortable with. For a man, it's going to be about $20 more. It's going to be $170. It could be a little bit less than that as well. Those rates actually could go down if you and your spouse get into the same company too. But that's something we'll talk to you about individually. Now you have to add a standalone drug plan. The standalone drug plans range. The range is huge on the monthly premium. It could be as low as $2 all the way up to over $100. We're going to assume that you're going to be in a plan for $18 a month, and that's a very fair assumption to make. So you're all in a Medicare supplement plan. If you're a female, that's 65 for $351. If you're a male, $373 per month. Remember, this doesn't come with dental or vision. Let's take a look at the green, the Medicare Advantage. Remember that Part A is $0. Part B is going to be $185. And that's it for you on a monthly basis. You're not going to have any extra costs. So I see my sister in the background there distracting me. So you're paying $185, but you have a lot more variables. If you're going to the doctor a lot, then you're going to be spending more. If you, God forbid, get a diagnosis and need chemotherapy or infusions or dialysis, you're going to be spending more. So there's more variables in the Advantage plan, but you're paying almost half or around half on the fixed cost per month, but you're exposed for a little bit more, but you do get those extra benefits like dental and vision too. So this is the juggle that people are going through when they're first getting on Medicare. And this is something that we will help you with as well. So that IRMA charge, that's if you're a high income earner and Medicare and the government says, we're going to make you pay more because you made money. So if you file your taxes as an individual and you made over $106,000 in 2023, because the IRMA charge is based on your tax returns from 2 years prior. So in 2025, if that's when you're getting in Medicare, it's going to be 2023 that they're taking a look at. If you as an individual made over $106,000, you're getting an IRMA charge for both Part B and Part D of Medicare. If you're a couple, you file together, and you guys made over $212,000 on your tax returns, then you will have an IRMA charge for Part B and Part D as well. Also, I want to mention there's a lot of reasons why people may have made a lot more money 2 years ago than they are now when getting on Medicare. They may have retired, so they may have worked a lot more then, or they may have sold a house or a business. And there is an appeals process to lower your IRMA charge. Sometimes they'll drop it a bracket. Sometimes they'll drop you all the way back up to the normal standard premium. That's also a process we can help you out with. It's an appeal, and it's not super rare that you would win that appeal because people, their income changes. So the government actually knows that, and it's not super uncommon for you to win.
All right, we're getting close to concluding here, but let me tell you a little bit about agents and how they work. First of all, if you work with an independent agent or any agent, it's not going to cost you anything because we get compensated by the insurance carriers. But it's also why you want to use an independent agent. You want somebody that can take you window shopping, show you all the alternatives, and then be able to put you in the plan of your choice that works best for you. If you work with an agent that is what they call captive, that works for one insurance company, they may be able to put you in the best policy from that insurance company, but it may not be the best overall for you. So independence as an agency is important, I think, for the consumer. But the independent agent is also going to give you feedback, going to give you advice. They're going to be able to talk to you about what your needs are, what your short term needs are, financial, medical, long term needs, and help you make a decision that makes the most sense for you. So I just want you to know that a couple of things about how we get paid in New Jersey. And in all states, agents make sometimes more than double the commission to put you in a Medicare Advantage plan than they do to put you in a Medigap plan. And what we're doing here as an independent agent is we're looking out for your best interests. We're not looking to make more money on one transaction. If you work with an agent, you want to get the sense that they're going to do the same thing for you. We build relationships. It's part of why we do this outreach. We look for a long-term relationship. Our clients are going to be happy to refer us to their friends and family, and they're going to call us the next time they need something. And that's what we're trying to do. That's what we've been doing for 6 years. It's what we continue to do. Our practice is still mostly Medicare supplement. It's just the nature of the beast. Now, that said, these Medicare Advantage plans are starting to include more benefits and they're becoming more popular. They're growing faster nationwide than the Medicare supplement plans are. And what we'll do is we'll take you on a journey and we'll figure out what suits you the best. And we're able to do that as your agent. We also provide you customer service when you go into the plan. We don't disappear on you the day that we enroll you. So though that's the logic. No insurance company can charge you a higher monthly premium. They can't charge you higher copays. They pay the full commission and they have to because without independent agents, they're going to make a fraction of their enrollments every year. So food for thought. You may have known that, you may have not have known that, but I just wanted to give you the wisdom of why it makes sense to use an independent agent. And we cover all of New Jersey, we cover Delaware, New York, Pennsylvania. Did I miss anything, Ethan?
I think you got it.
Florida, Virginia. So anywhere where we're referred to, or anywhere where our clients move to, we're going to get licensed so that we can keep supporting them there. So that's why we're in those states.
All right.
Is this
I'll
me or
take this
you?
one. I'll
Okay.
take this one. So, if you're collecting Social Security, then, like I said earlier, they're going to be sending you your Medicare card without you having to do anything. Now, if you're on a work plan and you don't want to be on Medicare, you're going to actually have to reject Part B. So, if they send it to you and you don't want it, then follow the steps on the letter that they send you. Send them the card back. They'll send you one with Part A only because it's free. It's backup hospital insurance. You'll be in the Medicare system. The only thing to note is if you have an HSA, you're going to want to stop contributing to that 6 months before you get on Medicare. That's something we'll talk to you about one-on-one as well if you have any questions. So if you're collecting Social Security, they're sending it to you automatically. Now, if you are not collecting Social Security, you got to knock on the door. You can either go online, which is what we suggest because it's the easiest. We can help you with that over the phone, or we can send you a step-by-step template and how to do that properly. You can call them if you want to wait on hold for 8 hours and get a lot of chores done, or you can go in person and you can sit in front of somebody and do it that way as well. Sometimes I recommend that depending on the situation, but most of the time you can just go online and apply that way. So what happens next? Well, I'm going to put a link to our Calendly here. If you guys want to make an appointment, you could take a look at that and do that now. And also remember, there is going to be a survey. Once this webinar ends, the survey is going to pop up and you're going to have the opportunity to just fill it out. It takes a minute or two. Tell us we did a good job. If we didn't, you could tell us that too. And you're going to get this booklet right here. It's the everything you need to know about Medicare. We're going to send it to you and you're going to be able to get a summary of this along with the outline of coverage for the Medigap and a bunch of other stuff as well. So if you guys want to keep in touch with us, you have that opportunity. If you want a Medicare guy, you have one now. You can also sign up for our monthly newsletter. It goes out once a month. It's got a lot of value in it. We keep you updated on Medicare. It comes with a crossword puzzle. We get you a recipe in there sometimes as well. It just really lets you know that, we haven't forgotten about you. And if you need us, we're there and we're in your lives.
Are there any questions or?
Yeah, we do have a few questions here. If anybody else has any other questions, please send them in, but I'm going to read some out to you right now. Stacy asks, can you have both a Medicare Advantage and a Medicare Supplement plan?
It's a good question, but no, you have to choose one or the other. You can't be in both at the same time.
Straight to the point.
Yeah.
Joe asked, is this webinar recorded and can you send it to me? Yeah, this webinar is recorded and we can send it to you. So if you want that, just in the survey, there's a note section, just, say, hey, Ethan, I want the webinar recording sent to me and I'll do that tomorrow for sure. Another question, Vincent asked, can you guys help me compare my work plan versus Medicare?
Yes, absolutely. We can help, put up a side-by-side comparison for you. We have found that sometimes the group plans that even if you can't stay on it, even if it's creditable, it may not be cost effective for you to do that when you compare it to Medicare. So we have a lot of clients who have kept working and had the opportunity to stay on their group plan, but decided to go off it because they thought they were getting better coverage and less expensive coverage now that they were 65 and they had opportunities to get into Medicare. Now, that's not always the case, but it is sometimes. And it gets more complicated than that. You might be on a spouse's plan, and we understand that. But yes, I highly recommend you doing a side by side comparison so you can figure it out. And then if delaying going on Medicare is what you decide, well, that's the right answer for you. At least you've done your homework.
Does Medicare Supplement come with dental?
No, Medicare Supplement is a secondary plan that layers on top of original Medicare. Original Medicare doesn't cover extra benefits like dental. So we package things together when we talk to our clients. If they want dental, it would require a separate plan, which you can get very easily. Yes, there's a separate monthly premium. but you can get standalone individual dental plans. If you're on original Medicare with a Medigap plan, you would have to, though. It's not included.
And then the last question I see right now, unless anybody wants to put anything else in the chat, how much will the Medicare supplement rates increase every year?
Yeah, they do increase, and they do increase every year. It's hard to say. Different companies, as Ethan explained, will have different levels of rate increases. Some of it has to do with the fact that they're insurance companies, and if their expenses are higher, they're going to spread the pain amongst their beneficiaries. There isn't really a set percentage that I can give you, even a range. Some years the average increase could be 3 to 5%, some years it could be 8 to 9%, but that's also an average. It doesn't mean that every company is raising their rates that high. What we do when we quote is we'll say, okay, this is what company A is charging a 65-year-old today. This is what that same company A is charging a 75-year-old today. Now, it's not a projection. We have no idea if they're going to be charging that when you're 75, but it gives you a little information about whether they have a strong foundation and whether they're really raising their rates at a very aggressive level as a rule of thumb or not. But there's no way for us to tell you that. There just isn't. There's no magic ball when it comes to rate increases. Another great question, actually a tough question, but a good one. Yeah.
All right. Well, that is it. Roberta, thank you as well for asking some really good questions. And thank you, everybody, for joining and asking your questions. And the survey is going to pop up here once we end this webinar. Feel free to give us a call with any questions. If you fill that survey out, you're going to get this booklet here that you can't really see. And yeah, thank you guys for joining. I
Thank
hope you
you.
got
Thank
something
you
out
all
of
for
it.
being here. Yep.
All
Good night.
right. Good night, guys.